We're joined by State Assemblywoman Nancy Muñoz, Deputy Minority Leader in the lower house in the Assembly, who also has a nursing background. Nancy, real quick, remind our audience your nursing background.
I'm a licensed registered nurse with a master's in nursing. I have a long history of critical care nursing, worked in surgical ICUs and trauma centers, and all of those experiences influence how I look at healthcare policy. But more importantly, I always keep the nurses in mind when we look at legislation because they're the greatest number of providers in the healthcare field.
Assemblywoman, we've heard so many healthcare executives, hospital executives, physicians, and others saying we are losing nurses dramatically 2 years into this pandemic. This will be seen later. Question, what the heck is the role, if any, of the government, state government and or federal government in trying to change the economic of this? Because so many nurses are leaving to become, what do they call, traveling nurses. They go to different hospitals. They're way more expensive. And what's happening is a lot of the hospital executives, we just had Sharif Elnahal, the former head of the Department of Health in the state, who's the CEO at University Hospital, said, we can't compete financially with that. The traveling nurses they're getting a heck of a lot more, and we're going to bust our budget if we try to compete. What do we need to do governmentally, policy-wise?
Well, I think one of the things we need to do governmentally is allow the nurses, the advanced practice nurses in particular, to practice to the full extent of their license. You know, that is an important issue I've been working on for 12 years. They have restrictions on their practice, and they would increase the number of providers. They're forced to sign a contract with a physician or MD or DO, and in many cases they have to pay that physician or DO to practice. We have a mental health crisis. We have mental health providers. So number one, increase the number of providers who can practice without restrictions. It's not increasing their scope of practice. It's simply letting them practice without having to pay to do so. The other thing is to make sure the nurses have a voice at the table when it comes to making policy within the hospitals. I have put in legislation to make sure that the nurses are part of the team that determines what the staffing is. I'm strongly opposed to staffing ratios, but I'm not opposed to allowing the nurses to be at the table, to say units that have a rapid turnover, that maybe they need more nurses per, nurse-patient ratio can be changed. Look at the acuity of the patient and look at the experience of the nurse and the nurses who staff that floor. Look at all those issues to make determinations. Make sure that the nurses are part of that decision-making process. I feel that sometimes the nurses are left out. They're left out of policy, but they're also left out of that decision-making process, and I think that's critical.
One more quick question. Nurses are clearly underpaid, or they can get more as traveling nurses. Can there be a standard rate for a nurse to be on staff at a hospital, in an emergency department, wherever, where he or she is there on a regular basis? Can the government do that, or is that being overly involved in the economic decision-making of individual hospitals?
I think it's a bad policy. As a person who believes that government should not be in that business of setting rates, because it just drives up costs. We have data that shows whenever the government gets involved, costs go up because there's no incentive to actually work toward efficiencies. So we already get there's already premiums that you get for working the evening shift, the night shift, weekends, holidays. Remember, hospitals are staffed 365 days a year, 24 hours a day. I worked since 1976, worked at Yale New Haven. We had premiums. If you worked the Christmas shift, you got time and a half. If you worked the evening shift, you got more. So there's incentives already there.
Finally, I'm sorry for interrupting you, Senator. Hasn't COVID changed everything in terms of the pressure on nurses? They're burnt out, they're leaving, they're getting better deals as traveling nurses, and they'll go around. It's just, they're getting better money.
Yeah, but you know what? That's true, but it doesn't work for everyone. To be a traveling nurse, you have to work. Do you have a family? Do you got to move your family every 3 months? Do you have to find housing? So there's other reasons that incentivize a nurse to stay at a hospital, including when hospitals provide continuing education so they can advance their degree in nursing. I think that's a critical part of keeping nurses there. And I support for nurses continuing their education, getting advanced degrees, and working toward getting a master's in nursing and at least a bachelor's in nursing. I think it's the least we can expect of our nurses. And those are the incentives that a hospital provides for a nurse who stays in the community. And the other thing I will quickly say,
real quick,
that nurses, we have loan forgiveness programs for nurses. We already have them for doctors who stay in underserved areas. Let's have loan forgiveness programs for nurses who stay in underserved areas, who stay for 5 years, who say, okay, I'm going to stay in this area for 5 years, provide mental health, primary care, and then we have a loan forgiveness program for them as well. I've been very supportive of that.
That is State Assemblywoman Nancy Muñoz, who knows a lot about not just public policy, but particularly the nursing profession. Nancy, all the best to you and your family. Thank you.
Thank you. Happy holidays.
Same to you. We'll be right back after this.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by RWJ Barnabas Health, New Jersey Sharing Network, the Turrell Fund, supporting Reimagine Childcare, Horizon Blue Cross Blue Shield of New Jersey, Johnson & Johnson, NJM Insurance Group, Operating Engineers, Local 825, Eastern Atlantic States Regional Council of Carpenters, Fedway Associates, Inc., and by these public-spirited organizations, individuals, and associations committed to informing New Jersey citizens about the important issues facing the Garden State. And by Employers Association of New Jersey. Promotional support provided by ROINJ and by Insider NJ.
I'm very grateful that I'm still here.
That's me and my donor when we went to celebrate our first anniversary.
With a new kidney, I have strength.
They gave me a new lease on life.
I'm still going everywhere and exploring new places.
Nobody thought I was going to be here. Nobody.
And I look forward to getting older with my wife. That's possible now.
We're transforming lives through innovative kidney treatments, living donor programs, and world-renowned care at 2 of New Jersey's premier hospitals.
They gave me my normal life back. It's a blessing.
RWJ Barnabas Health. Let's be healthy together.